My name is Sandy Adams. I am the lead financial planner and partner here at the firm. And again, we have done this for, I don't know how many years, several years in a row with Cynthia Brown from Powers Financial. We do a lot of things and know a lot of things about all things financial planning, but Medicare is one of those things that changes constantly. And you almost have to do Medicare all the time to know it really well. So Cynthia is one of our expertise specialists in this area that we go to when we have clients that come to us with questions specifically on Medicare. But we do coordinate with her on Medicare around retirement income. So there are times when we want to make sure that we're keeping your retirement income in line with Medicare premiums. If you've heard of IRMA, that's one of those things that we're working with in coordination with Cynthia to say, you know, is this particular client going to be close to an IRMA limit? Do we want to make sure we're taking income from certain income sources so that they're not paying premiums higher than they need to pay in a particular year? And there's a 2-year look back, as you know, with those incomes. So for instance, your 2023 income would impact you. It'll look back 2 years for your Medicare premiums. So we're looking back 2 years. So we have in your package, you'll see a couple of resources that we've provided. Nick Nepenthaler, who is out reading people, wrote a blog about can I avoid IRMA surcharges on Medicare Part B and D, just to give you a little bit of a sense of kind of the work we're doing behind the scenes each year with clients, and a flow chart of kind of the complexity of what that can entail. Which is why you don't want to try to do it on your own.
And I was even looking at the flow chart.
Yeah, it's a little crazy about all the things you have to be thinking. With that said, I am going to hand this over to Cynthia because she's our resident expert. We're hoping that you get something from this presentation, whether you're new to Medicare or you're simply trying to make sure that while you're making decisions in Medicare, and even though you're already a Medicare recipient, that you're making the right decisions, or to confirm that you're making the right decisions, or to double check yourself to see if there's something you're missing.
Ready to work? Righty. Well, thanks again for attending tonight. It's so beautiful out there that I could see where you might have wanted to just skip this, but grateful that you came. And so I'm going to be doing, basically, I call this like a Medicare 101. So for somebody that have already navigated this space, it might be information you've already had, but there may be people here that haven't. So I want to make sure I go from the ground up with Medicare and cover everything. And just a little background on myself. I've been an independent agent for the past 28 years. I like to say I started when I was 12 because that would make me only 40, but that would be a lie.
Nice.
But in the last 7 years, I've really narrowed my focus into helping people make that transition to Medicare because it's a space I really like. And I've helped over 1,200 clients do that in the past 7 years. So I've had a lot of experience with a lot of different situations. And a commonality I see with people approaching Medicare is not everybody, but a lot of people are somewhat intimidated by Medicare. It's got all these parts and all these letters. There's a lot of different rules, and the rules aren't necessarily the same for everybody. And it depends on whether you're still working and if you have a group health plan and how large that employer is. So it can be tricky to navigate. And I think what complicates things for people is they sometimes, as they're turning 65, have friends or family members, maybe neighbors telling them what they should and shouldn't do with Medicare, when really that person's just basically describing in their situation what they had to do or didn't have to do. So I'll get people that'll call me all the time and say, I'm still working. We talk about the size of their employer. You know, do I need to go on Medicare? My neighbor tells me if I don't, I'm going to have a lifetime of penalties. So we have to kind of like, back up and say, well, how large is the group? But so it's definitely something to be approached with caution, because I've also had people that really didn't need to enroll in Medicare and they went ahead and did it. And then they're paying for Part B premiums. when they didn't need to be. And they also set off this time clock ticking. I'm kind of jumping ahead of myself here, but there's a time clock when you enroll in Part B where you have 6 months to get any supplement you want without underwriting. So you don't really want to start that time clock before you need to. I feel like to make a painless Medicare transition, you really need to know 4 things. You need to know the rules. And as we talked about, the rules can be different based on your situation. Medicare's a lot of if this, then that's. But so knowing the rules inside out, knowing the timing is very important. I would say Medicare's not very forgiving if you don't get the timing right. They don't care if you didn't understand or if someone misinformed you. Yeah, they're just not forgiving. Yeah, exactly. And getting the process right. So I've got examples of someone who he got the timing right, he even picked a good plan, but he just filled out the application wrong and ended up with a much higher premium. He did it on his own. So I'll talk about that in a little bit down the road here. But besides those things, also knowing your plan options, because there's a couple different coverage pathways you can take with Medicare, and they are very different. And what you pick in the beginning when you're going into Medicare, and you're new to Medicare, can affect your choices down the road. So we're going to go over those tonight as well. And if you have questions, if you could hold on till the end, because I'm packing in a lot here, and sometimes you'll find I might answer them as I go along. You can always email me. My email's on the front of this presentation. If you have questions, happy to answer any questions you have. That works a little better than phone calls because I spend most of my day with people, but I can check emails in between. And I want to just mention there's a couple areas I'm not going to go into tonight. One is Medicare due to disability. I'm just barely going to skim the surface of that. I think I say 2 things. And I'm not going to go into, some people are eligible for both Medicare and Medicaid. They're called dual eligibles. So I'm not going to go into that space either because then you guys would be here way longer than you want to be tonight.
You don't want us to ask questions, but could you please spell out all the acronyms as you go along?
Yes.
Thank you.
And if I miss something, stop me. And sometimes I do start speaking in acronyms and just raise your hand. So what is Medicare? You probably all know this, but it's basically the U.S. government national health insurance program that began back in 1965. So it's been around for a while. It primarily provides health insurance for Americans 65 and up, but also for some people that are deemed disabled by the Social Security Administration. So not to be confused with Medicaid. Sometimes people get the terms confused. To be eligible, you must be a U.S. citizen or legal resident, and legal residents must live in the U.S. for at least 5 consecutive years, including those 5 years leading up to Medicare. So Medicare, original Medicare, consists of 2 parts, Part A and Part B. Think of Part A like facility coverage. So it's like room and board in a hospital or in a skilled rehab following a hospitalization. It also covers hospice and some medically necessary home health care. So that's your Part A. Part B is really where most claims flow through because that's all your medical services. Some people think Part B is just like doctor's visits, maybe labs, but it's some very expensive things. And I mentioned this for a reason, but things like if you had to have outpatient surgery, outpatient chemo or radiation, even like the doctor that does a surgery in the hospital, his fee goes to Part B. Durable medical equipment, you had to ride an ambulance, MRIs, CAT scans, literally hundreds of items covered under Part B, as well as your more day-to-day things like doctor's visits and labs and preventive care. Medicare covers a whole host of preventive care services. So for this year, and I don't have next year's numbers yet, but I'm going to talk about the out-of-pockets under Part A first, because while Medicare pays a lot, they don't pay everything. So they leave you, they leave you with money out of your pocket. But when I'm talking about these out of pockets, this would be if you just had Medicare A and B and nothing else to go along with your Medicare. But it kind of paints the picture of why it's probably not a good reason just to have A, probably not smart to have just A and B. But for this year, if someone's admitted to the hospital as an inpatient, there's a $1,600 deductible, and that would cover somebody for 1 to 60 days. That is not an annual deductible or a calendar year deductible. It's called a benefit period deductible. And the way that works with Medicare is it starts when someone's admitted to the hospital, and the benefit period ends when you've been out for 60 days. So if you had another hospitalization after that, you start with another deductible. Where it can get more expensive, and this is pretty rare, but it can happen, is if somebody has an extended stay in the hospital where they're there 61 to 90 days, they then have to start chipping in $400 a day for each of those days. And if you cross over into a 91st day, that copay doubles. Couple things happen. Copay doubles, goes up to $800 a day. And by the way, these numbers tend to go north each year. But the other thing that happens is you start dipping into what's called Medicare lifetime reserve days, which they give you 60. So all that means is for stays exceeding 90 days in the hospital, you only have this bucket of 60 to tap into. So if somebody was there 151 days, after that, they would start paying all costs for the remainder of the hospitalization. That's another reason why maybe going with just Medicare alone isn't a good idea. It's pretty rare for someone to be in the hospital that long. And keep in mind, anytime you are out of the hospital for 60 days, the 90 days renew and refresh. So you're always getting the new set of 90 days. And if you have something to go along with your Medicare, then you're not limited to, the schedule here of days. So another coverage under Part A that comes in, fairly regularly is a skilled nurse facility stay, especially, as we get older, people like to have any increases. And this is not like a long-term custodial stay. Medicare doesn't cover that. It's short-term, so it's meant to get you back home. It's rehabilitative. So Medicare will cover up to 100 days in that situation. The criteria is you have to have been inpatient in the hospital for at least 3 days. So it can't be like observation. You have to be admitted as an inpatient. You meet that criteria, Medicare will pick up the first 20 days. You have no copay for those. Days 21 through 100, there's then a $200 a day copay. If you get to that 101st day, you have to pay all costs. Now, if you're out of the skilled rehab, you haven't been hospitalized or in a skilled rehab for 60 days, and you have down the road another hospitalization that qualifies you, you get another potential 100 days. So it's a renewing benefit. It's just not a long-term benefit, okay? So Part A is premium free if you've had at least 40 quarters of work history, amounts to about 10 years of work in your lifetime. And that can also be based on maybe you didn't have that yourself, but your spouse had that. So you can qualify based on your spouse's work history. And sometimes some people qualify based on an ex-spouse or a deceased spouse. So if you don't qualify for premium Part Free A, you can buy it. I'll tell you, with all the people I've worked with, I've not worked with anybody that's had to pay for Part A. If you did, the premium this year is $506 a month if you have under 30 work quarters, or $278 a month if you have to pay 30 and 30. And it's very uncommon. Someone they have to pay for Part A. So Part B of Medicare, remember this is your medical services, and I mentioned a bunch of expensive things that can fall under there. This is where your biggest exposure is under Medicare. So it's got a small deductible this year under Part B. I call it pocket change. It's like $226 compared to my $7,000 deductible that I have on my plan. That just, I would love that, but I don't get to get that yet. So that's not bad. The deductible's small. The bad part is after you've met the deductible, Medicare will then pay 80% of your medical services. They leave you with the other 20%. And the problem is there's no cap on the 20%. So that's the biggest area of exposure under original Medicare is that uncapped 20%. And a fellow that called me 5 years into Medicare, and he had just done A and B. It worked really well the first 4 years, but the figure he got cancer and he had surgeries, chemo, radiation, testing. His 20% of it, 40 grand out of pocket that year. So of course, then he wants to do something else with his Medicare, but it's now really limited his options to certain types of plans because he's got this pre-existing. So the cost of Part B of Medicare, yeah, so these are the 2023 premiums. So if you're already on Medicare, you're familiar with this. I don't have the 2024 premiums yet. It's probably going to be another month, I imagine. And Sandy was mentioning this, that some people have to pay more for Part B due to income. So the acronym is IRMA, but that stands for Income Related Monthly Adjustment Amount. But this year, if you're on Medicare, they're looking back at the 2021 tax return. And if you are a single filer and you are under $97,000, then you would pay what's called the standard premium, which is $164.90 a month. If you're a joint tax filer, threshold is $194,000. So you have to be below that to pay $164.90. So there's 1, 2, 3, 4, 5 more categories of income. This is the one I like the least. The single one making between $183,000 and $500,000. That's a big range to all be paying the same premium. But it's always been like this, and I get single people that fall in there, it's like, it's shocker for them, because some people think that Medicare is free, and not. So yeah, for some people, it could be, quite expensive. So those are the premiums for this year based on income. They usually change every year, not only the premiums, but the thresholds. So we'll probably see that, 97,000 be a higher number next year to qualify for the standard premium. And by the way, this is based on modified adjusted gross income. And what that is that's line 11 plus line 2A on your tax return. So that's adjusted gross income's line 11, and 2A is tax exempt interest. So they add those two together, to determine your premium. They are always looking back every fall, 2 years back. So they keep looking every year and making a readjustment for the next year. So sometimes people will take in a year, maybe a very large capital gain, or sell a property, an income producing property, and it can kick them up into a higher premium for a year. Now, and this is this nice flow chart that they have for you. But basically there are reasons that you can file something called an SSA 44. So Social Security Administration form number 44. To let Medicare know, hey, I've had this life-changing event and I'm not going to make this year what I made 2 years ago. And the reasons these are the reasons you can file that. So it can be because of the death of a spouse or a marriage, divorce, or annulment. The most common one is the one in the middle there at the top, that you or your spouse stop working or you reduce the number of hours you're working. So work stoppage or a reduction in hours. Involuntary loss of income producing property due to a natural disease, disaster, fraud, or other circumstances. So it's not that you just decided to sell an income producing property. That doesn't qualify for this. It has to be an involuntary loss based on those reasons. Loss of pension to qualify someone for this. I haven't had anybody with this yet, but receipt of settlement payment from a current or former employer due to the employer's closure or bankruptcy. So those are the categories that they'll consider. And I put up here what this form looks like. It's a really simple form. Basically, name, social security number. The form does change every year, though they update it each year. And then you just check the type of life-changing event. So I help clients with these all the time. Usually we're doing work stoppage or reduction in hours. And then, so let's say, let me just give an example. You went into Medicare this past June and because you retired. And so in 2021, you had higher income. So now in 2023, that income is going to be reduced because you're going to have a year of not working. So what you would do in the step 2 is you put the year in which the reduction is going to happen. So in this case, it would be 2023. You have to estimate, because we don't know, exactly what we're going to make this year, right? Because of capital gains and things like that. You have to estimate your adjusted gross. And if you think you're going to have any tax exempt interest, check your tax filing status. And then in the next step, you put, if you think the year after you're going to be at the same income that you guessed for the current year, or if you think it's going to be lower. So you answer that one. Sign it, phone number, address. We fax them into the Social Security office for our clients. You could also drop them off at the Social Security office. I don't recommend mailing them. I just think that's, probably not the best way to go. It usually takes them, and it depends on the office. I find the larger the office, like for instance, Pontiac takes longer because they're servicing a larger area of people, or the smaller, more rural offices seem to process them a little faster. And oftentimes you have to file this, especially when it's because of a work stoppage, 2 years in a row, because they're going to redetermine that fall again, looking back at like this year, they're looking back at the 2022 returns. Which in the example I gave you, someone retired in 2023, they're still going to have high income in 2022. And they don't just carry forward this to the next year when you file it. So I've seen that just a handful of times where they did, but you would think because you're filling in that step, form that they would carry it over. But almost always you have to file this 2 years in a row. And they release the new forms every year in January. I've had some people that they're just so anxious to get it done. They want to use the current year form, and I advise them, I don't recommend that. But I had a couple people do it. And what happened was they reduced their premium, but then later in the year in October, they came back and charged back the difference. So I always recommend just wait for if you're looking for your 2024 premium to be reduced, wait till the 2024 form comes out. It's usually January 2nd every year they post it. If you've already paid some Part B premiums, because it takes them 4 to 6 weeks to process these, they will credit you back once they process it. So it's a very handy tool to keep in mind, not only to reduce those premiums, but as Sandy said, as you're planning for future years, trying to kind of stay within certain thresholds so that you don't overpay for Part B. If you don't file this, let's say you had that event and you don't file it, a couple years down the road, in the event of a work stoppage, let's say, they're going to see that your income went down. They're not going to give you the money back. So they're going to say, oh, he didn't make that much that year. We're going to give him money back. They just adjust it for the next year going forward. So you're really leaving money on the table if you don't file this and you have that qualifying event. Okay, so turning 65, and I don't know how many of you in here, I'm sure you're all 50, but turning 65, if you are, that's kind of a big decision time. And common questions I get, and I've already kind of talked about this, when someone's, you know what, people are working longer these days, so it's not uncommon for people to work past 65. The common questions I always get is, I'm still working, or my spouse is still working, and we're covered by a group health plan. Do I need to enroll in Medicare? Sometimes I get, well, I have retiree coverage coming. Do I need to enroll in Medicare? So those are good questions. So it's based on the size of the employer and whether the coverage is based on active employment, okay? So whenever your coverage is based on like something like COBRA or retiree, you need to enroll in Medicare Part A and B, okay? Because Medicare is primary to COBRA. And I had just a client recently that they went on COBRA back in March, didn't enroll in Part B. They were past 65 because they thought, well, we have COBRA, and the employer was paying for it for several months. Well, now, and they didn't come to me at the beginning. They came to me after the problems. But now they're getting claims rejected by the carrier because the carrier's like, no, you're supposed to have Medicare Part B. We don't have to pay because we're paying after Medicare. So the question is, does the employer that you are still actively employed for, or your spouse is still actively employed for, that you're covered on their group health plan, do they have 20 or more employees? Okay. If they do have 20 or more employees, you can delay Medicare without penalty because that group health plan is going to be primary to Medicare. I'll talk in a minute about the next question is, should I get Part A? We'll talk about that in a minute because there's different reasons to and not to. But yeah, and I always say check with your HR department if you're not sure. So if the group, this is kind of a icky area. If the group has less than 20 employees on the payroll, then Medicare is primary and you need to enroll in Medicare Part A and B. So that's why when people call and ask that question, it's like, well, it depends. Are you still actively employed? How many people are on the payroll? And if somebody has that group health plan and the employer's small, under 20, and they don't get Medicare, same thing can happen, like the situation I just gave you with COBRA, where the carrier can decline paying claims. So it's not a good place to be. And so then the question is, if you're on that small employer and you have to pay for Part B anyways, does it make sense to stay on the small employer plan? So we'll talk about that. And I already mentioned this, but if you have retiree coverage, you almost always need Part A and B. The only kind of exception I can think of that is the federal employee FEHB. They have some different roles, but again, you can always check with your former employer to confirm requirements, but typically they might need to send them a copy of your Medicare card when you're on retiree coverage. And they're continuing to offer retiree coverage at 65. They want to see proof of that Medicare card. Some employers stop offering retiree coverage once you're Medicare eligible. So I get that a lot. We talked about COBRA, yep. So common questions when the group health plan is primary, and that means they have 20 or more employees. They're large. You can delay Medicare without penalty. But people will ask me, well, should I just enroll in Part A? I hear Part A is free. And actually, I had a guy that I had a meeting scheduled with in August. He was turning 65 in September. He was still working. He thought that he had to go online and register with Medicare or he'd have some kind of penalty. So he went ahead and enrolled in Part A. So we were talking and I said, well, how big is your employer? We talked about the size of the employer. He said, yeah, I know I can delay Medicare without penalty, but I went and enrolled in A because I think I need to do that to get registered with Medicare. And I said, well, that might be fine. I said, but do you have an HSA plan where you work? Yes. Do you want to keep contributing to that HSA? Yes. Well, once you enroll in any part of Medicare, you're no longer eligible to make contributions to the HSA. So he's like, oh no, and it's like, so now he's got to try to undo Part A. If you just waited till our conversation, I could have avoided trying to undo something, untangle something. But that is definitely a reason not to enroll in Part A while you're still actively employed for that employer, the HSA code, the HSA. Sometimes people ask me, well, what about Part D? I hear there's a penalty if I don't enroll in Part D when I'm first eligible. And other people ask, well, if my contribution to the plan is significant, or I don't like the group health plan coverage, can I leave it for Medicare? So I kind of already answered that first question, should I enroll in just Part A? I would say, yeah, if you don't have an HSA plan, it actually makes it easier when the time comes that you retire to add Part B if you already have A. It's not that you can't get them both when you retire, it's just a faster process if you already have Part A to add that Part B. This gets a little complicated, but the other reason not to enroll in Part A, if you're continuing to work and you have that group health plan, is if the group health plan's drug coverage is not credible, which means not as good as Medicare's. If you enroll in Part A, then you have set that penalty clock for Part D. So if you don't have credible coverage and you don't enroll in Part A, you haven't started that time clock. So it's a little bit confusing, but that would be another reason not to enroll in Part A is if your group health plan's coverage is not, drug coverage is not considered credible. And this is why Medicare is tricky. There's all these like rules and landmine areas, but should you enroll in Part D? So I kind of covered those. Yes, if your group health plan coverage is not credible and you enrolled in Part A, then you're going to want to get a Part D to not have that penalty down the road. And can I leave my group health plan in favor of Medicare? So generally speaking, yes. Sometimes the employer wants to see proof that you have other coverage, that you enrolled in something else. Keep in mind, if you have dependents on that group health plan, you're going to want to likely stay there or they're going to lose their coverage. I have had some people, like I've had a Ford employee one time that he was covered through his wife. So they were contributing something for it. But he knew he was going to have some surgeries coming up and they had a high deductible. So he's like, you know what, I just want to make the move to Medicare. And I know I'm going to have lower out of pocket. So he did. I'm happy. Especially because that year he had a surgery in December and then in January. So he would have hit, double deductibles. Okay, so when Medicare is primary, some of these slides are coming up weirdly here. Actually, it's 7 years too. It's the same. All right, so in real blah, blah, I'm going to read through to see what I'm talking about here. So when Medicare is primary to the group health plan, meaning that this is when somebody is working for an employer with less than 20, some considerations, since you have to pay for the cost of Part B in that situation, would it be less expensive to leave the group and go on Medicare? So it depends on what you're contributing, what your share is. Some people pay quite a lot to be on a group health plan. Other people don't pay much at all. So that's something we look at, on an individual basis. We compare benefits, we compare premiums. Again, if you have other family members on the group health plan, GHP needs group health plan, they'll lose coverage if you leave the plan. Here's kind of another one of those icky areas with Medicare. If you have that small group coverage, and so you got to enroll in A and B, do set that 6-month time clock for enrolling in Part B, in which you can get any Medicare supplement you want without underwriting. So when you go to retire someday, if it's past that 6 months, there will be Medigap supplement plans you can get. They're called guaranteed issue, but carriers don't have to offer you the whole menu of plans that they do when you're within 6 months of your Part B effective date. Now I want to talk about when you can enroll in Medicare. There's basically 3 different times. So the initial enrollment period, which a lot of people use, is when you're turning 65, so you're brand new to Medicare. Another one is called a special enrollment period. That's used when you continue to work past 65, you're outside that initial enrollment period, now you're retiring. So you would use what's called a special enrollment period. And I'm going to go over, what that looks like. The last one is the one you hopefully don't end up using, the general enrollment period. Because that's every year from January through March. That's the coverage is effective the first of the month following enrollment, but that means you missed one of the top 2. And so that likely means you're going to have a penalty. But it is there for people who missed it. At least once a year, they get the opportunity to enroll. So that initial enrollment period is the 7-month period surrounding your 65th birth month, so it's 3 months before, the month of, and the 3 months after. Anybody here born on the first of the month? Okay, if you were, your timeline starts 1 month sooner. Everything starts 1 month sooner. If you sign up during the first 3 months of your initial enrollment period, so those 3 months before the month you turn 65, your Medicare will be effective the first of your birth month. And some people ask, well, I'm born on the 31st. You still get the first of that month, for your coverage. If you sign up the month of your 65th birthday or the 3 months after, then it's going to start the month after you enroll. There's really 2 options. There used to be 3 for enrolling in Medicare. You used to be able to go to the Social Security office and do it, but now they're telling you they don't want you to come in, basically. They'll say you can do it online, or you can call them and set an appointment. It's usually about 6 weeks out, in which they'll call you back and take your application over the phone. I did it, most of my clients we help them do it online. They're either in the office or I'm on the phone with them, telling them, where to go, what site, what buttons to click. But it's basically online at ssa.gov/Medicare, gets you more directly to that application. You have to have an ssa.gov account to do that. If you don't have one, I definitely recommend setting up an ssa.gov account for a number of reasons. I've had 2 clients that have come to me that are forever barred from having one because somebody else set it up for them. And they're, yeah, it's a fraud issue. So you want to create it for yourself before somebody else does. And it's pretty secure. Anytime you log in, you're going to get a text, with a code, but highly recommended. Now, here's the thing. If you're collecting Social Security at least 4 months before you're turning 65, you're going to automatically get a Medicare card in the mail. I had a gal a few weeks ago. She was really cute. She says, I've been saving all my Medicare now because you're the most popular person on the planet when you turn 64 and a half. So I got a pile 12 inches high. Well, I haven't looked at any of it yet. Okay, so we get into the discussion. She tells me she's collecting Social Security based on when she met with me. They sent that card about 4 months before. So, well, you should have your Medicare card already. She goes, no, I haven't gotten that. I'm like, go home and look in that 12-inch pile you've got. And sure enough, her Medicare card was in there. So that could be good if you want to go on Medicare at 65, but maybe you don't, because maybe you're still working or maybe your spouse is still working. You're going to want to opt out of Part B if you've got that, employer coverage based on active employment, yours or your spouse's. Most likely you're going to want to opt out of it anyways. I mean, the discussion can be had, how much does it cost, etc. But you have to actually follow the instructions and send the card back to opt out of Part B. They won't let you opt out of Part A once you're collecting Social Security. And here's another thing, if you are working past 65 and you didn't enroll in any part of Medicare, maybe you have an HSA plan, and you didn't want to stop contributing. And so now you're 67 or you're past your full retirement age and you've decided to trigger Medicare, not Medicare, Social Security, they're going to automatically enroll you Part A. And they backdate at 6 months. That can be an issue for people at HSAs too, because maybe they've already contributed and now they backdated the Part A 6 months. So we walk people through that. There's excess withdrawals you can do out of HSAs, but they have to be done the right way. You can't just take a withdrawal. If you use the proper form, get the process right. So the special enrollment period, again, this is for someone who is working past 65 and has that group health plan coverage. So while you're working and have active coverage, or your spouses, you can delay Medicare until they retire, or you can enroll in Medicare anytime while they're still working. You have up to 8 months after that active coverage ends to enroll in Medicare without penalty. I don't recommend you wait 8 months, but that's the period you have to do so without penalty. We are usually trying to line things up so employer coverage ends one day, Medicare starts the next day. That's the ideal way. So I also want to, before I show you what the special enrollment period, how you do that, just mention that sometimes people are retiring during their initial enrollment period. So during that 7-month window, the IEP time frame for Medicare effective dates trumps the special enrollment period. So sometimes you have to work people through that, based on when they're retiring, when their birthday is. Okay, this is when you want to enroll to get the, most optimal effective date. So there are forms required when enrolling under a special enrollment period. And these are the two forms. So if you already have Part A and you're retiring, you're going to fill out that Part B application for Medicare and Part B. Also, the request for employment information, that is something the employer has to complete. So basically attesting to the fact that you've been covered starting when the coverage is going to end. This may not apply to any of you, but this is being recorded, so I want to put that out there for someone who may be listening and may apply to. I've had people that have worked many years past 65 for more than one employer. I had a gal that took a GM buyout this year. She was 89, so she was just retiring. That was her third employer since turning 65. So GM's coverage only went back, 6 years or whatever. I'm like, well, this is great, but you need to go back to those other two employers and get the same form. And by golly, she did, because that's not always easy to do, to go back that many years. So I always, when I'm giving these talks, I always advise people, if you have more than one employer after turning 65, like when you're leaving an employer, get the form then, put it in a safe place. It's hard sometimes to get it when you're going back years. Oh, but typically we walk people through this process with the special enrollment periods like tax and the Social Security. If you don't already have Part A, it's a little bit of a different process. You have to basically build your profile online with SSA.gov, enroll in A and B, and then just fax the request for employment information to the Social Security office. But part of the process we like to help people with because we want them to get the results that they're wanting to get. So general enrollment period, that's what I've mentioned. If you missed your initial enrollment period or your special enrollment period, you do get an opportunity every year from January through March 31st to enroll. Coverage begins the first of the month after enrollment, but you'll incur a 10% penalty for every 12-month period that you went without Medicare Part B if you didn't have that, group health plan coverage, and it stays with you for life. The penalty clock starts ticking the day after the last day of your initial enrollment period. So remember, that was that 7-month period. So yeah, this is why you kind of want to get the timing right on Medicare. There are penalties that, can happen and do stay with you for life. So we've kind of talked about what is Medicare, the parts of Medicare, the timing, how you get enrolled, whether or not you need to enroll, which again is kind of based on whether you still have an active group health plan and the size of that employer. And I know I'm repeating that a lot, but it needs to be. But let's say you've got it all figured out now, and you've got your Medicare A and B, or you're getting it. There's different coverage options to go along with Medicare. There's basically 2 different pathways to take with your Medicare, and they're very different. So they are keeping your original Medicare Part A and B and adding a supplement, also known as Medigap. So 2 terms for the same thing. That's one option. Okay. The other option is something called a Medicare Advantage plan. And that is an alternative to Medicare. So while I can't talk about specific plans and specific premiums, that's something more one-on-one, because then this would become a marketing meeting and there's like compliance, taller than this building with that. So I talk very generally speaking, in this type of a setting. But generally with a Medicare supplement, you're going to have higher premiums than you would with a Medicare Advantage plan. Not always, because some Medicare Advantage plans are expensive. But usually people going on the Medicare Advantage plans are going for those lower premium plans. On original Medicare with a supplement, Medigap plan, you can see any doctor in the country that takes Medicare. So you have the best access to doctors on original Medicare with a supplement. And that could be part of your personality. I mean, do you want to have the best, biggest selection of doctors? It may be that you have a home in more than one state and you want to have easy access to doctors no matter, where you're at. That's another big reason. With a Medicare Advantage plan, they're going to be network style plans. So they can be PPOs, they can be HMOs, they can be POS, which stands for point of service. But they are going to have a network of doctors. Not all doctors take Advantage plans. So, and the ones that do, they can pick and choose which ones they want to. And that can change every year. So doctors can leave plans. With original Medicare and a supplement, no referrals are necessary. You will see specialists. With an Advantage plan, it depends on the plan. Some do require referrals, some don't. Here's a big one. With original Medicare, it's very rare to have to get prior authorizations for services. That's not always the case with the Advantage plan. So especially as people are maybe not as healthy and they have more things that are going on, there's going to be more prior authorizations with an Advantage plan. And that's right in the Medicare U book that you get every year. It spells that out. So I think I even just kind of verbatim took it. In many cases, you may need to get approval from your plan before it covers certain drugs and services. With original Medicare and a supplement, it's not going to include, like, people ask about this all the time, what about dental vision? Well, that's not like included in the rates of a supplement, but many supplement carriers do have buy-up options for dental vision and hearing. Most Advantage plans do include some type of basic dental, maybe a vision frame allowance type of thing. So they have extras. They tend to have extras on the Advantage plans, like over-the-counter allowances, meaning they give you a certain amount of money every quarter to spend on over-the-counter items. You know, using the appropriate vendor with the plan, things like that. If you go with original Medicare and a supplement, that does not cover prescriptions, okay? Because when I talked about Medicare A and B, I didn't anywhere mention prescriptions, and that's because they're not covered under A and B unless you're inpatient in the hospital. There are some drugs that would then be covered in the Medicare Part A. Medicare Advantage plans, most of them include prescription drug coverage, so they wrap it, you know, all together. By the way, Medicare Advantage it replaces Medicare. So someone that goes on an Advantage plan, they're no longer using that Medicare card. Medicare's not processing their claims. They just get a card from the Medicare Advantage plan that they pick, whatever the carrier is. But yes, most of them include prescription drug coverage. This is what's really important that I really like. If you don't get anything else out of this, this is a good thing to take away. Some people will pick an Advantage plan because they're healthy and you can get them for low premium. Now, mind you, there's a lot of copays on Advantage plans for medical services. So lots of copays. You have to really look at the details of those plans. But they might pick that because they're healthy. You know, they're not going to the doctor much, thinking that later in life they could hop over to the supplement where you really, the most popular supplements, you have very little out of pocket from medical services. So they think, okay, I'll slide over there when I start having issues. Problem is the underwriting rule. You know, so once you're 6 months past your Part B effective date, supplements ask medical questions. And they can decline you or they can rate you higher based on your current health, your past health. If something's been recommended, a surgery or procedure that you haven't gotten done yet. Contrary to that, let's say you start out with a supplement, Medicare supplement, and you later want to go to an Advantage plan, there's open enrollment every year for the Advantage plan. So that's an easy move to make once a year to the Advantage plan. So I want to go over, and this is getting into the weeds of Medicare, but there are some exceptions to that 6-month rule for the underwriting on the supplements. They're called guaranteed issue rates. So sometimes people do have a guaranteed issue rate to get that supplement without underwriting. So that would be like, and I kind of mentioned this earlier, but if your employer plan that supplements Medicare, so the small under 20 employers or employees, if that coverage ends, you then have a 63-day period to enroll in a supplement without underwriting. It's called guaranteed issue. But you don't necessarily get the full menu, okay? There's some plans that they can eliminate from that. And I have a really good example. How am I doing on time, Sandy? Okay, I can tell the story. This is a good story. So I did a presentation several years ago at a CPA convention. And I mentioned, you know, the 6-month rule, and I talked about this, and one of the CPAs approached me afterwards and says, boy, I know what you mean about it being the best thing to get that supplement within 6 months. You know, I retired and I enrolled in a supplement. And I thought it was going to be X amount of dollars a month, and they came back and it was like 3 times that. And I said, well, okay, so what was the size of your employer? And it says, yeah, it's under 20. I had to get A and B, so I already had that. I said, well, did you enroll within 63 days? Of losing that group health plan coverage? He goes, yeah. He said, I had everything lining up perfectly. I said, what carrier did you go with? And he told me the carrier. And I said, I bet you answered question 4B incorrectly, because 4B on that application says, do you have a guaranteed issue right? So he went back home and looked, and he had checked no. He should have checked yes and sent proof of that loss of employer coverage, and then he would have gotten the preferred rates. He'd been on it for a year, paying a couple $100 a month more than the standard rate would have been. And I said, you know, write a letter to the carrier. It's kind of a long shot, but, tell them you filled the app out wrong. Tell them that, send them proof that you had the employer coverage and that it ended, plead for mercy. So he did that, and I was amazed. They not only reduced his rate, but they gave him back the 12 months he had already paid, the extra premium. But, if he hadn't attended that and we hadn't talked afterwards, he probably still would be paying that higher premium. But that's an example of someone who got the timing right. They even picked a good plan. I felt like the plan they picked was good, but they got the process wrong. They filled out the application wrong. And it's because some people don't know what guaranteed issue means, and they're answering that question. No, I don't know it, so I must not have it. So just, an example of, again, where you can look it up. If you're with a Medicare supplement and they go bankrupt, you have the right to enroll in a new Medicare supplement without underwriting. This next one doesn't really apply in Michigan because there are no Medicare select plans in Michigan. There are in Florida. So if you're listening and you're in Florida, but if you're on a select plan and you moved out of that plan service area. So select plans, those are still Medigap plans, but they've chosen to have a select network of doctors. So they're, like I said, they're not in Michigan. Insurance company didn't follow the rules or they misled you. If you're Medicare, I've had some people enroll in a supplement because of this one. Their Medicare Advantage plan dropped coverage in their area. So that gave them a guaranteed issue right to get a supplement. If you joined a Medicare Advantage plan at 65, and you, and so your A and your B and your 65th birth month all have to line up, same date. But if that happens, you do get a 12-month trial rate on a Medicare Advantage plan. You can leave during that 12 months and get a supplement without underwriting. The other reason is, let's say you started out on them, and you know what, Medigap and Medicare supplement are the same thing. So I'm using both those terms, but remember, it's just two terms for the same coverage. But let's say you started out on a Medicare supplement plan and you decided you watched the TV commercials and you called the number and you made a switch to the Advantage plan, and then decided within a year you wanted your Medicare supplement back. You would have that trial rate, but that's like a one-time deal. So you had to have Medigap ever since you started with Medicare. You made the move to an Advantage plan and then decided within 12 months you wanted to go back to your supplement. Okay, so I can't give you like a chart of Medicare Advantage plans. It'd be as long as a football field. Yeah.
I think that last slide was not included in the packet, or am I missing it? That
one in the
Well, I don't know why.
different order.
yeah, I looked through.
It's one of the.
Maybe I'll have you resend the final version.
This would be the final. That's the only one I sent. I only sent one.
Well, you know what, we'll resend it.
So you'll get it like in PDF.
Yeah.
So again, I can't have like a nice comparison chart of the Advantage plans. So for one thing, it's illegal. We're not supposed to do that. For two, it'd be too long. There's too many of them. But Medigap plans, supplements, these are standardized by the government. So these are pretty straightforward. What's a little confusing is they decided to name them with letters. So we've got Medicare Parts A and B, right? We've got Part D for drugs. There's also Medigap supplement plans named A, B, and D. So yeah, it does get a bit confusing. I'm not gonna like talk about all these because I'm running out of time, but a Medigap supplement plan F right there in the middle. Those things on the left, those categories are the out-of-pockets I talked about under Medicare Part A and B, the deductibles, the copay, the co-insurance. So Plan F picked up 100% of the out-of-pockets that Medicare would leave you with under Part A and Part B. So as you say, F is fabulous. It's been grandfathered, so you had to be born before January 1st, 1955 to get a Plan F. Same with Plan C, they're grandfathered plans. And the reason is they picked up the Part B deductible. Government decided back in 2014 that they wanted people turning 65 in 2020 and beyond to at least have to pay that Part B deductible on a supplement. So G is really where most enrollment's been going in the supplement world for probably about 7 years now. And the only out of pocket with Plan G. So these follow Medicare. Supplements work in tandem with Medicare. Medicare pays first, they send the balance to the supplement. And on a Plan G, your only responsibility would be the Part B deductible for the year. So this year, that's $226. So if you're on a supplement and you're having Medicare covered medically necessary services, you're not going to pay more than $226. You're done. N is the second most enrollment. the last probably 7 years. So, and I'm really not gonna talk about the other ones tonight, but, and after the deductibles met, you still have some co-pays. It's up to $20 for an office visit, up to $50 for an emergency room visit. The reason it's up to is you're paying 20% of the Medicare approved amount, not to exceed those co-pays. So co-pays after deductible, there's one other though, blank area. You can see over here, G says 100%. Under N, it's blank. That's called a Part B excess charge. There are some Medicare providers that while they take your Medicare, they don't accept Medicare's approved amount. And that's okay, the government lets them do that. But the government says, but you can only charge 15% above that approved amount. So that 15% is called an excess charge. And if you're on a plan N and you went to one of those providers, that would be your responsibility. But these are standardized plans. Carriers can't deviate from the structure. So a lot of carriers offer these. And that again is more of a one-on-one, education process as to which carriers might be better ones to pick in that world. There's definitely, because you under 65, you can change your plan every year in the individual world. No medical questions asked. We have the underwriting rule here. So you really want to make a good decision on a carrier you pick in the beginning. In case your health, doesn't allow you to move down the road. So we kind of covered that. All right, so let's talk about Part D. So if someone's going with Medicare and they've decided they're going to go with a supplement. So they've decided they don't want an Advantage plan, they want a Medigap supplement. Typically, they're going to pick up something called a Part D prescription drug plan because Medicare doesn't cover prescriptions. So there are quite a selection of Part D plans out there. We have a program where we input people's scripts and it basically tells us based on the scripts which carrier is going to be most advantageous based on co-pays, premiums, which pharmacy you might want to use. So what I have up here is, and this has changed for 2024, but this is the standard Part D model that the government has set. So the carriers offering Part D plans, they have to be at least at this level, but they can also have, I guess, improved benefits or lower out-of-pockets. But this is the standard. They have to be at least this level. So for this year, the annual maximum deductible for prescriptions is $505. That's going up to $545 next year. Some plans don't have deductibles. Some plans have lower deductibles. Many plans waive the deductible on tier 1 and or tier 2 drugs. So lots of people are just, not paying that deductible because they have tier 1 and maybe some plans are tier 2 as well. So for this year, there's something, it's called the initial coverage stage. That's a stage where you pay either $1 copay or a percentage copay. And if you have any drugs subject to deductible, you've met the deductible. So that initial coverage stage goes until your total drug costs hit $4,660. Most people don't reach that. And that's what the carrier's paying and what you're paying. But if you're on expensive drugs and that number is reached, you then go into the coverage gap where you pay 25% of the cost of your prescriptions for the remainder of that year. So for next year, that $4,660 is going up to $5,030. And then you would hit the coverage gap. So for this year, let's say you get in the coverage gap. If at some point what you've paid for your prescriptions and the brand name discount during the coverage gap, which is 70%, hit $7,400, you would then move into that catastrophic stage. By the way, most people don't even get to the coverage gap. Some people do, but most don't. Catastrophic stage, you pay the greater 5% or $4.15 for generics and $10.35 for brand names. Next year, they're eliminating this catastrophic stage, which is good because it means if you get there from that point on, you pay 0 copays for the rest of the year. So that's an improvement for next year. In 2025, they're capping out-of-pocket copays for people on Part D at $2,000.
You said not to ask questions. This is under Medigap or Advantage?
Medigap. But you know what? You say that, but Advantage plans still have to have that standard model as well.
Yeah. They say this
Yes.
model.
Yeah. Okay, so kind of getting back to the IRMAs, the income-related monthly adjustment amount. If you have an IRMA for Part B, the government also charges you more for Part D. So same categories of income, you can see that, you would pay an extra. Now, oftentimes have people in these categories and they're like, okay, well, why am I paying a premium for the drug plan and I'm paying, an IRMA? It's like, well, the government's getting the IRMA, not the drug plan company. They're getting the premium. So the government's charging you more. we're working hard and making more money. So I mentioned some of the changes already that are coming to Part D. One thing I didn't mention is this year they capped insulin copays at $35, and they also eliminated the cost sharing for, I don't have it, oh, I do have it up there. The shingles vaccine is now covered with a zero copay under Part D. So that's good because people were paying about $400 before for those. Am I good? Oh, is it missing too? Okay.
I'm gonna get
On the back page of the urban. There's the visit one.
So if you miss, okay, so the Part D penalty, how that works is for every month someone goes without prescription drug coverage since they were eligible for Medicare and didn't have a group health plan with credible coverage, okay? It's 1% per month. So if someone turns 65 and they decide they don't want Part D, and sometimes people aren't taking scripts, they're like, why should I do Part D?
Yeah.
You don't have to. But let's say they go 5 years. Well, now they've got a 60% penalty on their Part D for the rest of the life. And it's not on their Part D premium, it's on the national Part D premium, which is oftentimes high, national average, which is oftentimes higher than what their plan premium might be. So that's the trade-off for not getting it. Do we have time to talk about HSAs and Medicare, or are we done?
Yeah, you're.
Okay. I will just say briefly that it can get complicated, the intersection of HSAs and Medicare. So that is something, if you have an HSA and you're contributing to it, you want to make sure that you know the rules about when those contributions have to stop and how much you can put in the year you go on Medicare. Because it's not just like, okay, now I'm on Medicare, I can't contribute anymore. They look at what you've already contributed for that year. So it's, again, something to be careful of and, you know, have a discussion about with someone who's knowledgeable in that area. If you have an HSA account and you've got money in it, and you get to Medicare, you can use it for Part A premiums, although most people don't have those, but you can use it for Part B premiums, Part D premiums, and Medicare Advantage premiums. You can't use it for Medigap premiums. Okay. I kind of talked about that. I'm not gonna. Thank you for attending today. And I'm sure this is probably information that didn't necessarily apply to all of you, but thank you for being patient and listening through it. Did you have any questions?
I really don't understand the advantage of Medigap over advantage over Medicare.
And so basically, the advantage with the Medigap plan is you can see any doctor in the country that takes Medicare. So you're not limited to a smaller network of doctors based on that advantage plan and who participates with them. If you have much less in the way of prior authorizations for services, so it's very user-friendly coverage. Again, here's the thing, so someone with known health conditions going into Medicare, another thing is you have a lot less out of pocket for medical services on a Medigap supplement. So on a Plan G, you have $226. On a Medicare Advantage plan, lots of copays for every different, I mean, a very common one for chemotherapy is 20% coinsurance on an Advantage plan. But you have to really look at, and you know, we help clients with this, but you have to really look at all the out of pockets under the Advantage plan, because you might be saving premium, but if you get sick, you might be a trade-off in what you're paying for your copays. And then you might have, it's more insurance company involvement. Basically, the government gives the Medicare Advantage plan a set amount of money each year for each person on their plan. So they are more profitable if they're managing your care more.
Okay, so with the Medigap. Right. Okay, the premium right now is $226 per month.
No, that's the Part B deductible.
Okay.
Premium is, yeah, the premium is going to be based on age. But looking at you, it would not be that much.
Okay, so you want to switch from Advantage to Medigap, would you get an estimate of cost?
Yeah, yeah.
Okay.
Definitely. Yeah.
I still don't know what the advantage is for one for the other. Just got to compare costs.
It's not only cost, it's your personality and your risk tolerance for, like, if you get cancer or something and you want to go to Mayo, are you going to be able to on an Advantage plan? You want to go to China, you know, so part of it is, yeah, what freedom of choice you want with doctors, how much you want to be having an insurance company involved in your care.
I would say, I think a lot of people will take the risk with the Advantage plan because they think they're healthier and they don't. They're anticipating they don't have the risk of a big health event. The risk they're taking is they get the big big health event, and then they're putting the risk of out of pocket expenses if they get that big health event, whereas if you're more risk averse,
Yeah, exactly. Well, I had, a gal was very healthy. She wanted the Advantage, which is fine. We talked about if you later want to go to a supplement in your past 6 months, we talked about the medical underwriting, but she was happy with it for 3 years, and then she got cancer and she couldn't go to the cancer facility she wanted to because they didn't participate. Well, now she wants to switch to a supplement. It's like, well, remember our discussion, it's like, you can always change to a different Advantage plan once a year. That's not a problem. You can go back to original Medicare A and B once a year. It doesn't mean you can get the supplement to go along with it. So
Get someone will underwrite.
it's the underwriting, yes.
or the supplement, they're paying a little bit extra along the way, but you're sitting there going, okay, I feel a little bit safer. If I have a health event, I'm already in a place where I'm gonna be covered at less expense.
They can't touch that.
Exactly, and they can't rate you, they can't increase your premiums any more than the next person that's. So it's not like they can always having health issues, we're gonna raise them up for those now, they can't do that, so.
Within the Advantage plans, there's I presume a range ranging from really restricted HMO types to
Yes, it's definitely a range.
kind of a PPO, Blue Cross PPO that we kind of used to with our employer.
Yeah.
Has that been a range or is it much more restricted?
It's-
I have a PPO now that's.
The people, I would say the Blue Cross PPO Medicare Advantage plan is not the same as the group PPO member. It's different, yeah.
The page you had on the supplements or with the letters
Yeah,
that we don't have. That one went right over my head.
this one?
Yes.
Okay, so if you decided, okay, I want to get a Medigap or Medicare supplement, that's the type of coverage I want. You then have this menu of options. Unless you were born after January 1st, 1955, then you don't have F or C. Those are grandfather plans.
Okay.
But the other ones, that's the menu you have to pick from.
Where are those different?
Right there. I mean, that's it. If you look in the Medicare new book, that's the same.
Well, let me ask you another, it's probably no question, but I'll be talking about supplements, so I understand A and B and C and D.
Right.
Well, C I don't get, because that's not eligible, but. So these are other supplements that you could add on?
Yeah, so this is in addition to your Medicare A and B.
Right.
Because you have like a lot out of pocket on just Medicare, so a lot of people choose to pick up a supplement that works in tandem with Medicare. So Medicare pays their share, and they send the balance to the supplement carrier, and based on what plan you pick, like let's say you went with a plan G, it would pick up that $1,600 deductible for you, no matter how many times it occurred in a year. It would pick up the $400 and $800 daily copays if you crossed into that territory. It would pick up the $200 copay in a skilled rehab, and it picks up all of the 20% co-insurance in full. So the only thing the plan G doesn't pick up is the Part B deductible. So the government has defined these, they're standardized. Lots of carriers offer them, they can't deviate from this. I think these are the most straightforward, really, because they're defined by the government and it's not like there's a lot of different copays for services, it's just black and white.
I won't take you.
No, it's fine, and if you want to reach out to me individually,
Yeah,
I can go over it.
back to the Medigap. The doctors, you can go to any doctor, if you want, what if you're out of the country?
Good question. So Medicare is really pretty ruthless for the country, whether you have an Advantage plan or a supplement or, just original Medicare. Medicare doesn't pay for anything out of the country. Supplements, Medigap plans, like a plan G, so where you see 80%, it's not just 80% of whatever, it's after a $250 deductible, so that's a separate deductible for emergencies out of the country. A Medigap plan would pick up 80%, you pay 20%, but they cap the 80% they pay at $50,000 in a lifetime. But that could be, we go through that really quick. We like actually Geo Blue for international travel for people on Medicare. They have very reasonable, I mean, you can get a plan with $1 million worth of coverage, 500 deductible for 65-year-old, it's about $50 for a week. $100 for 2 weeks, but you only take it out when you're gonna be gone. Yeah, you don't need to have it year round. So we use that a lot. It covers pre-existing conditions. It's
One more quick question on the prescription thing with, there was a deductible and there was a second line, what was it, initial coverage or something?
Yeah.
I mean, I have some expensive medications, so is it an additive? Is it the deductible and then the
copay.
whatever, it was
or the co-insurance.
4,500 or whatever, and then.
So
at
someone-
what point does it become zero to me? I don't know how to look at it.
And that's for like analyzing your drugs and putting it into the program because it's gonna tell us at what point you're gonna reach based on those prescriptions, those different levels of coverage, spells out what the copays will be along the way. It's really hard to just look at that model and try to figure out where you're gonna be.
And did you say that all Part Ds follow that,
They have to,
those
the
thresholds?
coverage has to be at least that good. There are some that offer, there's some that don't. They can be better than that, they just
Okay.
can't be worse.
Okay, gotcha.
And then, of course, they change it.
They do,
Okay,
they
I
do.
assume.
Always,
I assume.
I did mention this, so if you're on a Part D plan, just like an Advantage plan, you can, with an Advantage plan, you can switch to a different Advantage plan every year. Part D, you can switch to a different Part D plan every year. So that period is October 15th to December 7th to make a change for a January 1st effective date. So, yep, no medical questions or.
And you should look at them every year because
Yeah.
their formularies change every year.
For some of our clients right now, we've already come across people that'll save, you know, like one person that's looking at take $2,000 by changing their Part D plan. So we,
I know.
we're diligent about.
That's why you should work with them. Can help you look at it, you know.
Yeah, some people ask me, well, what do you charge? It's like, there's no fee. It's basically if we write plans for you, whoever it's with, they pay us.
Oh,
So,
because that is one of the questions.
yeah,
Just, with the Medigap, no vision, dental, et cetera. So are there independent options out there?
Yes. So some of the Medicare carriers do have buy-up options for dental vision hearing, so it's an extra cost on top of the supplemental premium. There are also standalone, like Delta Dental has standalone individual dental plans, Blue Cross does. There's standalone vision plans. So yes, there are definitely ways to have that coverage. I always advise people, well, I think those are good coverages. I advise don't pick your Medicare plan based on the dental vision, because if you get cancer, you're not gonna care that you've got
Right,
this, you know.
Right.
Yeah, they're limited plans, you know, dental only covers so much a year. Limited. Great question though.
Thank you.
Any other questions or? And I know I gave you a ton of information that doesn't necessarily apply to your situation, so I apologize if some of this just wasn't relative to you, but
Most of it was. I have
Okay.
one more quick question. Are all doctors required to take Medicare?
no. They're not required. So the vast majority do. Occasionally we see one that doesn't, it's, you know,
Okay.
it can happen, but there are some doctors that are like concierge doctors, they don't wanna
Wow.
deal with insurance at all. Yeah. Yeah, the vast majority participate in Medicare.
And when, let's say I turn 65, a year from this one.
So I would start the conversation about 4 months before. And part of it depends on if you're collecting Social Security, are you gonna get that Medicare card in the mail? Or do you have to trigger the A and B application? So 4 months before is a good time to start advising how to do that. You know,
I'm gonna go 6 months.
yeah, 6 months is fine too.
Okay.
This was really, really helpful. We're already on a plan, but does your life become completely crazy once it hits October 15th, or are you able to find time
Oh,
to
we find
possibly take a new?
We find time, we do. Yeah, we get it done. Yep, not a problem. I just, the bigger we get, the more we just have to ask people. So,
Which is not good.
not a bad thing, right?
How many people?
Right now, 2, me and 2 others, so I'm thinking I need another one pretty quick. But it's like, I also don't wanna be this entity where you're always getting a different person, you know what I mean? I stay pretty involved with my clients over the years, so I never wanna get to that point where I don't know who you are. Well, there's a balance there. Some people do die, so that opens up, right? It happens, it's almost like.
That's me.
Thank you.
Thank you so much, and you're bound to have questions once you go home and digest this information, so please reach out to either your planner here at the center or to Cynthia directly, and we will make sure your questions. Thank you so much for coming. Absolutely. Yes. Thank you. Thank you.
Thank you.